Now today I am going to talk about patella subluxation and dislocation. The difference between subluxation and dislocation is that subluxation is half dislocation. I mean, this patella climbs the heel, but it's not deviated fully. If it's deviated fully, it's called dislocation. In any case, it's a problem, both social, anatomic and sportive problem, because patella is the joint that carries the especially leverage arm of the knee joint. If it's dislocated, if the knee mechanism is disrupted, the strength of the muscle of quadriceps will decrease, and also there will be an inconfidence for the patient, and some sportive activities and even daily activities. The patient cannot perform the daily activities and the sportive activities. There are many causes of patellar dislocation, because before we begin to treat the patellar dislocation, we should define the underlying pathology of the dislocation, because there may be some anatomic problems, there may be some functional problems, and there may be some traumatic problems that may cause the patellar dislocation. The patella rests in a sulcus, what we call the trochlea, in an anatomic model like that. In some cases, if this is not so deep, if the trochlea is not so deep, this will not resist the patellar subluxation, and the patella will go towards the lateral side of the trochlea and it will dislocate. And in some cases, the binding angle of the quadriceps tendon may be laterally located like that. In that case, the patella will move towards laterally and it will easily subluxate or dislocate. In some congenital problems like hip rotational problems, what we call the anteversion, increased anteversion deformities, since the hip joint will rotate externally, this will cause lateral forward location of the patella, and also this will cause dislocation of the patella to the lateral side. Whatever the cause, sometimes all the problems may locate at the same patient, or sometimes one or two factors may combine and leads to dislocation of the patella. What's the treatment of patella dislocation? First of all, if the dislocation is the first time, we usually treat the patient in a conservative manner. What is the conservative manner? First of all, we direct the patient to the physical therapy for muscle strengthening, and if the patient can strengthen the quadriceps muscle, it will hold the patella in its sulcus so that it will not move easily. So muscle strengthening is very important for the patellar dislocation. In some cases, we advise to use the patient some braces that holds the patella in the sulcus. This kind of orthoses are called patella resisting knee orthosis. By this way, it's possible to hold the patella, and during the healing time, the patella will not dislocate it anymore. But in any case, I want to mention that the recurrence rate of the patella dislocation is very high. It's approximately 60%, over 60%. But in any case, we do not usually advise the surgical intervention for the first time. But there are one intervention, one exception. The exception is that if during the patella dislocation, the cartilage underneath the patella is broken, immediate surgical intervention is required, because we should fix the cartilage to the bone immediately. It's very important for the survival of the cartilage. What we do for the surgical intervention for patella dislocation? Before the surgical intervention, as I said previously, first of all, the exact pathology, the underlying pathology of the dislocation must be evaluated promptly. For this reason, sometimes we do hip computed tomography examinations, sometimes we do leg length x-rays, so that the underlying pathology for the patellar dislocation should be evaluated promptly. When the etiology is defined, then we do the surgical treatment accordingly. If there is a increase in the binding angle of the quadriceps tendon, then we usually use osteotomies that for medialization of the tibial tubercle. If there is a problem with the anteversion, then we usually make osteotomy through the femur to internally rotate the femur. Usually there is rupture of the medial patellofemoral ligament that's combining the patella to the medial side of the knee joint, so that we usually add reconstruction of the medial patellofemoral ligament to prevent the recurrences. In any case, the exact mechanism must be defined before the surgery, and the surgery must be done accordingly.